Welcome to Musical Rounds. My name is Melanie Ambler, and I'm an aspiring physician-musician. What this means is that I'm a classically trained cellist, and I'm about to begin a career in internal medicine. This podcast began as a year-long research project, which I did in between my third and fourth years of medical school at Stanford. As a medical student, one of the main things you do during a hospital rotation is interview patients about their pain, symptoms, and discomfort. Then explain or present that information about the patient to the entire care team during daily check-ins that we call rounds. If you've seen Grey's Anatomy or House, you probably know what I'm talking about. But I wanted to know what would happen if I rounded with music and storytelling instead of conventional medicine. So I created musical rounds. During 30-minute bedside sessions, patients would tell me stories from their lives, and I would improvise a soundtrack on my cello to accompany these reflections. The people you'll meet in this series are all receiving something called palliative care. The root of that word, to palliate, literally means to comfort. Palliative care is not necessarily about finding a cure. It's about helping people with life-limiting illnesses navigate their journey and accompany their final years, months, weeks, days, and hours with dignity and comfort. Everything you're going to hear in these episodes was recorded in a single take, live from the hospital room. It's an honor to share these stories with you. Thank you for listening. But before we begin, I want to tell you the story of how this all got started. I first started playing the cello when I was 8. It was kind of love at first sound, and I truly fell in love with the way that the instrument can connect with people. The cello is the closest in sound register to the human voice, and it kind of spans from the lowest bass male voice all the way to the highest soprano. And I think for that reason, it's an instrument that can really hit those emotions quite deeply because it's so similar to our human understanding of sound. It wasn't until actually after undergrad that I started thinking about how music could translate into a medical environment and what that might look like. I had a chance during the COVID pandemic to offer virtual concerts for patients that were in the ICU in a hospital in Denver. We were essentially offering just on-call bedside music sessions with a wheelie iPad, and those sessions really opened up my eyes to how this instrument, which I fondly call Shelby, can essentially reach patients and their families in moments of deep vulnerability, of stress, anxiety, discomfort, and pain, and offer some level of solace and human connection that brings them out of their hospital room and into who they are and what's important for them outside of that experience. Shelby, before she was named Shelby, came into my life when I was 16. It was my birthday present from my parents and my grandmother in lieu of a car. And that's been the best investment ever. In 2021, when I was moving from Connecticut to Stanford, I had to book a ticket for my cello to be able to fly in the plane because you can't put it under and you can't put it over. So it has to get a seat next to you. And I had this absolutely hilarious conversation with a Delta Airlines representative named Shelby. Shout out to Delta. I don't know where Shelby is, but she has a cello named after her now. She has now gained an entire persona. Her case used to have googly eyes on it. It was a whole ordeal. I'm not one to name things normally, but this lives beyond me now. She is her own person, and she's also my partner in life. I would often consent people without Shelby in the room. I would leave her in the hallway to make it feel less pressured. But once they said yes, I would then go outside and grab her and walk in. And I'd often just introduce her as if she was like another character in this recording session. And so I'd say, "This is Shelby." And then I just have so many recordings of people responding, "Hi, Shelby." And they would laugh and they would smile and they would essentially have this disarming reaction to this instrument. And it made the beginning of the actual recording sessions feel like we had built so much more rapport, and like that rapport was able to be made quicker because of her name. She's deeply comforting. She provides solace for me when I'm having a difficult time, but she can also get pretty angsty and really dig in and reach the depths of some of the hard things in life.
Shelby, that's awesome.
Shelby, so nice to meet you.
Hi, Shelby. Happy to see you. You're very beautiful.
Shelby, it's very nice to meet you. I hear you're going to play me some beautiful music today.
In medical school, our clinical years and our preclinical years are divided pretty clearly in that we have 2 years of preclinical coursework where we're going to lectures and we're doing simulation sessions. And then we're thrown into the hospital environment and we have around 4 to 8 weeks in different specialties to get a sample platter of medicine and also hone more of our clinical skills. And in between that, we have a 3-week break. During one of those weeks, I happened to be accepted to a music program called Honeywell Arts Academy. And so I went with Shelby and my mind was completely blown and I learned how to improvise. Flash forward, literally I left that program on a Saturday and on Monday of that week was my first clinical rotation, which was trauma surgery at Santa Clara Valley Medical Center. And so it was quite a contrast, but during my first week, I met a patient who happened to be a musician. He was a bassist, pianist, and composer. And during our rounds with the clinical team where we check in on pain and nausea, etc., he mentioned that he was really worried he would never be able to play the bass again because he shattered his left hand in a car accident. And so I told him that I was a cellist, and for the next 3 days, he kept asking me to bring Shelby in to play for him. And the medical team was kind of, shaking their heads, being like, "No, we're surgeons. We're not going to have the med student bring in their instrument." But he was so insistent that they said, "Mel, bring her in." And so the next day, I showed up with Shelby. I went to his room. I asked his nurse permission if I could go in, and he said yes. But today the patient's actually quite annoyed because the IV pole is alarming and it is incredibly obtrusive. It is so loud. So I walk in, start playing my first piece, and the alarm goes off. And it is so loud. Horrible, horrible noise. And I'm playing and I can see the patient just tense his entire body. He was distracted. He was not enjoying the music at all, even though this was something he had been looking forward to for days. And so after the first piece, I got up to go and turn off the IV pole, which had started alarming, and I started to listen. And I listened closer and closer, and I heard that the IV pole was giving me a beat, and it was giving me a pitch. I went to mute it, and then I sat back down, and he looked at me, he's like, "Does the med student not know how to turn off the IV alarm?" And I said, "Bear with me, let's create something together." And so I sat back down, I asked him, "What do you hear?" And he was like, "An alarm." I said, "No, what do you actually hear?" And we decoded, okay, this is a B, and it's giving me a beat. I then proceeded to improvise this kind of winding melody as an ode to the IV alarm. And as I was playing, his entire body that was initially really tense just started to completely melt into his bed. And he was tearful. I closed my eyes, he closed his eyes. And when I opened them, he was sobbing. And he said, "Melanie, you just made something so ugly sound so beautiful." And I turned to him and I said, "You're a musician. You're a composer. When that goes off, sing along to it. Don't get annoyed by it. It's giving you a creative opportunity." That was really a crazy first experience that I had, being able to bring my instrument into the hospital and play live instead of virtually. And those sessions then piqued my curiosity in terms of what could this look like as an actual program? What could this look like as a research study to be able to understand how this impacts patient pain, stress, anxiety, and comfort, and also loved one pain, stress, anxiety, and comfort. This year of research, which was in the years of 2024 and 2025, we recorded 100 bedside sessions with 100 patients and 87 loved ones. And each of those participants had data associated with them, where I asked before and after what those pain levels, stress levels, anxiety levels, and comfort levels were. And afterwards, I went and kind of analyzed what that impact actually looked like. And it was pretty astonishing. Average pain, stress, anxiety all decreased, and comfort increased over the course of just one 30-minute to 45-minute session with myself and with Shelby. I would essentially ask patients and families about their lives, about favorite places, favorite people, childhood memories, anything that would bring out an identity that was not physically in the room. Because, everyone in a hospital room is not wearing what they want to and is not in the state that they want to be seen or, frankly, to be recorded in. For family members, interestingly, their stress and anxiety levels were higher on average than patients and also significantly improved. And there's a lot of data that shows that family members of critically ill patients experience really high rates of post-intensive care syndrome, which is essentially like a specific form of post-traumatic stress disorder, specifically from having had a loved one in the hospital in the ICU. What that then looked like for a lot of family members who reached out after the sessions, even months after, was that they had a recording of their loved one's voice that they could refer to and listen to whenever they needed support and comfort, especially after the loss of that loved one. The recording actually offered so much more as a form of building legacy and of sharing that with people that they loved. As a portion of that sharing, patients and loved ones had the opportunity to choose whether they wanted their recording shared with the public. And I initially included that just because I thought maybe some people would want their stories to impact other people in a way that maybe they didn't know quite yet, but they wanted it shared if it could help someone. It was not a requirement for participation. It was just an extra box to tick on the consent form. And 75 people out of the 100 said that they wanted their story shared if it could help someone else, which was shocking to me. I did not expect that this many recordings would be available and willing to be shared with listeners and with people that might be going through something similar, with patients themselves, with families themselves, with healthcare providers, with other musicians that are interested in music medicine. And that's kind of the archive that we are working with in this particular audio series. It's letting these patients and families speak largely for themselves, share the stories that they want to share the context that they want to share, and being able to offer that for anyone to listen to. In science, we think of a bell curve where the most common emotions, let's say, are under the highest area of the curve in the center. But there are tails that extend quite long and are emotions that maybe we don't access every day. And I think speaking with so many people and recording these stories has allowed for those tails of both the highest of highs and the lowest of lows to extend so far that they actually, I think, meet. And I think I've learned that there can be simultaneously so much joy and laughter and so much grief all in one. And that you can hold all of those things together. There are so many sessions that you'll hear that are full of laughter and joy and positivity. And I think it's the last thing that you would expect to hear if I were to just tell you on paper what the project is. I hope that these recordings allow you to feel. I want you to take in these stories and hear what's truly important from these individuals. And potentially that will help you look out the window and see that the sky is a little bluer, that the flower outside your apartment has just bloomed, or maybe it'll make you hug your loved one a little bit longer than you do normally. For me, that's what they do. Musical Rounds was created by me, Melanie Ambler. Music by Shelby the cello. This episode was produced by Grace Carroll and Chase Morano and engineered by Michael Shofi. Visuals by Janice Tijan. Musical Rounds is supported by the Peak 2 Foundation, Healing Hands Scrubs, Stanford Med Scholars, and the Arnold P. Gold Foundation. Special thanks to Mary Beth Kirchner and the Honeywell Arts Academy. Next time on Musical Rounds. So, here we go.
4 cancers since you were 23. I said, yeah, I don't know. And he goes, well, it must have been quite a fight, quite a fight for you. And I said, I don't fight cancer. I said, it's my friend.